When should I get an STI test, considering the window period? Understanding when to get tested for sexually transmitted infections is crucial for your health. The window period is the time between potential exposure to an STI and when a test can reliably detect that infection. Testing too early can lead to false negative results, meaning you might think you are clear when you are not. For chlamydia and gonorrhea, the window period is about 1 to 2 weeks. It is best to test after 2 weeks from exposure, as most infections will be detectable by then. However, retesting at 3 months is recommended to confirm your results or after treatment. When it comes to HIV, the window period varies depending on the test type. Nucleic acid tests can detect infection as early as 10 to 33 days after exposure. Antigen and antibody tests typically detect infection between 18 to 45 days. Antibody-only tests may take up to 90 days. Testing at 1 month can catch most infections, but a follow-up test at 3 months is essential for accuracy. For syphilis, the window period can be as long as 90 days. Testing is usually reliable 3 weeks after symptoms appear, but it is advised to retest at 6 and 12 months after treatment to ensure you are clear. Herpes symptoms can show up within 1 to 4 months. Testing is done through swabs of sores or blood tests, but there is no routine screening for those without symptoms. Hepatitis B and C have window periods that range from about 2 weeks to 6 months, depending on the virus and test type. Retesting at 6 months may be needed for confirmation. If you have had a specific sexual exposure, it is wise to get tested around 3 weeks after exposure for most STIs, as many infections become detectable by then. Because some STIs have longer window periods, a follow-up test at 3 months post-exposure is recommended to confirm negative results. If you test during the window period and receive a negative result, it does not fully rule out an infection, so retesting later is important. For recent high-risk exposures, such as possible HIV exposure within 72 hours, immediate medical consultation is critical to discuss post-exposure prophylaxis. Routine STI testing every 3 months is advisable for individuals with ongoing risk factors, such as multiple or anonymous partners. When preparing for an STI test, remember to know the timing of your last potential exposure. Different STIs requiring different testing methods, such as urine, blood, or swabs. It is also wise to abstain from sexual activity until testing is complete to avoid reinfection or transmission. Discuss with a healthcare provider which tests are appropriate based on your sexual history and symptoms. In summary, to ensure accurate STI test results, wait at least 2 to 3 weeks after exposure before testing. Consider a repeat test at 3 months to cover longer window periods. This approach helps ensure infections are detected promptly and reduces the risk of undiagnosed transmission. Always seek personalized advice from a healthcare professional for testing schedules tailored to your situation.